All right, so it is 1 o'clock and I'm going to go ahead and get started. My name is Kristen Fleming, for those of you who don't know me. I am the Training and Education Coordinator for the Alzheimer's Disease Caregiver Support Initiative. We have a grant from the New York State Department of Health that provides services to caregivers in 6 counties in upstate New York. They are Clinton, Franklin, Essex, Warren, Washington, and Hamilton counties. And the services that we provide include care consultations where you meet one-on-one with a care navigator. Right now, these are all happening over the telephone. Training and education like you're doing today. So right now we're offering webinars. We also have an online training that you can complete at your own pace. And everything is happening either virtually or over the telephone. We do support groups, which are meeting over Zoom or over conference call lines. Memory cafes, which are social events. So we'll either hire a musician or we'll provide all of the supplies to do an art project, and then everyone gets on Zoom to complete the project together. It's a lot of fun. We also offer a limited amount of respite, so that would pay for you to get a little bit of a break as you need it occasionally. It's not meant to replace full-time caregiving, but it does help you so you can, go to your doctor's appointments, get your hair done, visit your friends, whatever it is that you would like to do. And the last thing I want to let you know about is our Project Lifesaver program. So if your loved one is at risk for wandering, let's say you go take a shower, go to the bathroom, wake up in the middle of the night, something like that, and you don't know where your loved one is. Well, this would be a bracelet that they would wear that uses radio frequency waves. So you look around in the backyard, you check the neighbor's yard, you can't find them anywhere. So you call 911 and they dispatch a sheriff's department they have a big wand that they wave and they use the radio frequency waves to locate your loved one. It's very, very reliable, and it is a nationwide program. So if you are on vacation in Florida, you can call the sheriff's department down there. They would be able to still locate your loved one. It's a really wonderful program. All of our services are totally free. They're open to the public. You don't need to be, you don't even need a referral from a doctor's office or anything like that. You just need to be a caregiver for someone with memory loss, and you are welcome to attend any of our events. I do have just one quick housekeeping note before we get started with today's presentation, and that is that you are in a listen-only mode. So that means I can't see or hear you. However, if you have questions or comments, feel free to either type them into the chat box or the Q&A box, and I will either answer them as we go or at the end. So let's dive right into today's presentation, which is on health and hygiene for caregivers. And I want to start out by asking you a question. What is health and wellness? So feel free to type that answer into the chat box or to the Q&A box, and just tell me what you think when you think of health and wellness. I feel like we hear these words a lot, and it means different things to different people. So I want to chat a little bit about that. So take a minute, and I'll wait and see if anyone sends any messages. What is health and wellness? Well, when I think of health and wellness, I like to think of a variety of different types of health. And I really liked this quote from and diagram from the International Council of Active Aging. They said wellness is derived from our ability to understand, accept, and act upon our capacity to lead a purpose-filled and engaged life. In doing so, we can embrace our potential physical, emotional, spiritual, intellectual, social, environmental, and vocational to pursue and optimize life's possibility. So those are all different types of health. And as caregivers, it's really important for you to consider not only your own health, but also the health of the person that you are caring for. So, some ways we can think about physical health, that would include eating healthy, exercising regularly, and you don't have to be doing vigorous running or any kind of really intense activity. You could go through a leisurely stroll through a park like this couple is doing here. And maybe a full 30 minutes a day is too much for you, but you could do 10 minutes after breakfast, 10 minutes after lunch, and 10 minutes before dinner, or something like that. Sleep is important. It's very important to be getting the recommended amount of hours of sleep a night. Managing stress. This is the biggest one, especially for caregivers. You know, they're very, very stressed and overwhelmed with everything that caregiving entails. So managing that stress and making sure you're taking care of yourself. Limiting alcohol if you do drink, not smoking, still getting regular checkups and following medical recommendations from your doctor. I hear all the time that caregivers are neglecting their own health because they're too busy with their loved one. And it's really important for you to take the best care of yourself so that you're able to take care of your loved one. It's kind of like the oxygen mask analogy. You can't uh, help someone else with their oxygen mask on a plane until you have your own mask on. Emotional health. Coping with challenges and behaving in respectful ways to signify emotional wellness. So this, again, stress management ties into our emotional health. Could look into peer counseling. I think even just chatting with a friend, like these two ladies are doing in the picture, over some tea, or over the phone right now with COVID times, can be very, very important. And just sharing a laugh, finding the humor. We laugh all the time in my support groups, and everyone says, you know, you have to laugh, otherwise you'd be crying. And it is true. It's okay to laugh sometimes. Social. So this is definitely tricky with COVID-19, but having social interactions is very valuable for maintaining health. You can spend time with friends, family, neighbors, whether that's in person or on Zoom right now. Can join clubs, travel, volunteer. There's lots of ways to be involved, even with COVID. Going to our memory cafes or doing a virtual game night with your friends and your family, uh, having a phone call or a FaceTime call with your friends and family, can really make a big difference. Intellectually and intellectual and cognitive health, meaning engaging in creative and intellectually stimulating activities. There are a lot of online classes you could take. You could journal or write. You could do games or puzzles that make you have to think. Start artistic hobbies like painting or joining a theater company. There's also a lot of virtual programs that are available. I know here in Plattsburgh, the Senior Planet is doing a lot of fitness classes and other types of classes, to really help keep you engaged. There's a lot of museum tours that are happening right now as well. So that's something to think about. And if you are interested, but you're not sure where to look for something like that, let me know and I can happily get you involved, or get you more information on these types of programs. Oh, I don't know what happened to my picture. My pictures here got messed up. Whoops. Well, professional and vocational health is work that utilizes a person's skills and creates personal satisfaction. So, this could include both paid and unpaid work, volunteering. It improves your skills and helps others. Caregiving, teaching, mentoring, and vocational hobbies are all ways of developing your professional and vocational health. Spiritual health, living with meaning and guided by personal values can increase feelings of well being. So, connect with a religious community or engage in your own personal meditation or mindfulness exercises like yoga and Tai Chi. Even spending time in nature can be really good for spiritual health. Environmental health, respecting the earth's resources, reduce, reuse, recycle, spending time in natural areas like walking trails and vegetable and flower gardens. Now, all of these things are really nice to be mindful of and aware of, but how do we actually get these into our everyday lives? Well, eating healthy foods helps everyone stay well. It's even more important for people with Alzheimer's and dementia. And so here are some very simple tips for healthy eating. Buy whole foods such as vegetables, fruits, and whole grain products. Be sure to buy foods that a person likes and can eat that are easy to prepare, such as the pre-made salad kits and single food portions. It might be helpful to have someone else make meals and or use a service like the senior home delivered meals. You can contact your county's office for the aging for more information. Sometimes with dementia, it can be really hard for someone to request what they want to eat. So give them maybe two choices. Would you like salad with grilled chicken or steak and green beans for dinner? Maintaining familiar routines and serving favorite foods can help meal times be easier. They can help the person know what to expect and to feel more relaxed. If a home health aide or professional provides care, family members should tell this caregiver about the person's preferences. If the person has always eaten meals at specific times, continue to follow that routine. Serve meals in a consistent, familiar place and way whenever possible. As Alzheimer's progresses, familiar routines and food choices may need to be adapted to meet the person's changing needs. For example, a family custom of serving appetizers before dinner can be preserved, but higher calorie items might be offered to help maintain the person's weight. Be patient and give the person enough time to finish the meal. View mealtimes as an opportunity for social interaction. A warm and happy tone can set the mood. Respect personal, cultural, and religious food preferences, such as eating tortillas instead of bread or avoiding pork. And prioritize safety. If the person with dementia is living alone, he or she may forget to eat or need reminders. Look for safety issues such as forgetting to turn off the oven or burning food because it was left on the stove too long. Other difficulties, such as not sitting down long enough to finish a meal and refusing to eat, can arise in the middle and late stages of the disease. These changes can lead to poor nourishment, dehydration, abnormally low blood pressure, and other problems. Caregivers should monitor a person's weight and eating habits to make sure he or she is not eating too little or too much. Other things to look for include appetite changes, the person's level of physical activity, and problems with chewing or swallowing. Talk to the person's doctor about these changes in habits. Physical activity has many benefits for individuals living with dementia. It can help improve endurance, poor coordination, sore feet or muscles, and depression or general lack of interest in activities. Here are some tips for helping the person with Alzheimer's disease stay active. Exercise together. It's good for both the caregiver and the person with dementia. This makes it more fun for both of you and can help motivate the person with dementia to participate with you. Try a variety of different activities. Watch exercise videos on YouTube that are made for older adults, such as chair yoga, go for a walk, dance to music, use resistance bands, lift light weights, or do household items such as cans of soup. Even doing simple household chores like sweeping and dusting help get some movement into your day. Be realistic about how much activity can be done at one time. Several short mini workouts might be better than one long workout. Make sure the person wears comfortable clothes and shoes that fit well and are made for exercise. Be sure he or she drinks water or juice after exercise. People with dementia may no longer feel thirst the same way you or I do. It's important to make sure that they still stay hydrated. I want to switch gears a little bit and just talk about planning for doctor's appointments. When planning for the doctor's visit, make a list of questions and concerns you have. If it makes sense, include the person you're caring for in the planning as well. Ask them what you can do to be helpful during the visit. Ask what type of questions they might have for the doctor. If there are other caregivers in the situation, such as your siblings or your children, ask if they have any questions or concerns for the doctor as well. Bring a list of all the medications your loved one is currently taking, including any over the counter medications or vitamins and supplements. Make sure you include or know the doses of each of these medications as well. And it's particularly important to do this if your loved one is seeing more than one doctor. It can be easy as a caregiver to be the one who talks to the doctor and answer all of their questions. However, as much as possible, let the person with dementia answer the questions if they're still able to. If possible, respect your loved one's privacy and leave the room if necessary during their exam. If you live out of town, talk to the doctor about how to stay up to date on your loved one's health. Maybe there's an online portal you can register for. Ask about community resources. In some practices, this might mean talking to the doctor. In larger practices, there may be a social worker that you can meet with and ask questions about community resources. It's important to realize that a person with dementia will, at some point, most likely have a hospital stay. When there's a hospital stay coming up, planning can help make it go smoother for the person with dementia. Think about if hospitalization is the right step. Speak with your physician to discuss all of the options that are available and what would be appropriate for your loved one. Have a care team to help you through the hospitalization. Don't try to do the whole process on your own. Ask the doctor if there's any way the procedure can be done outpatient. If not, can any of the tests be done before admission? Try to make the hospital stay a little bit shorter. Know what kind of anesthesia will be used if they're having a procedure done. General anesthesia can have a lot of side effects that affect a person with dementia. So a local anesthesia might be a better option if possible. Ask about regular medications and if they will be continued. If possible, can you get a private room? Will your insurance company cover it? A private room will be much calmer and less confusing for a person who has dementia. Involve your loved one in the planning process as much as possible. Don't talk about the hospital stay as if they're not in front of them, as if they're not there. Shortly before leaving your home, tell your loved one that you are spending time in the hospital. Now, that's great for an hospitalization that you're planning ahead for, but what about in an emergency? Have a plan in place can help alleviate some stress when or if the time comes that there is an emergency and you need to take your loved one to the ER. Bring a family member or friend so someone can stay with your loved one while someone's talking to the doctors or running to get coffee, whatever it is you need. Be ready to answer a lot of questions, sometimes multiple times. You may have to speak to multiple people in the hospital, explain the situation over and over again. It can be exhausting, but be ready to do that. And tell your loved one that, or tell the ER staff that your loved one has dementia. Now, it might not always be possible for or a lot of times hospital staff doesn't have a good experience working with people with dementia. So they might not understand why your loved one is asking the same questions over and over again, or doesn't seem to be responding well, doesn't remember what brought them into the hospital, is really confused or agitated. So be mindful of that and explain dementia to the emergency room staff and explain why your loved one's acting the way that they are. Comfort the person, be patient with them, and do not leave the emergency room without a plan. During the stay, ask doctors to limit questions for the person with dementia. Help staff understand. Try to have someone stay with your loved one at all times and tell the doctor immediately if the person seems worse or different. Ask friends and family to keep others updated. So you could be the point person, you let one person know and they tell everyone else. Help your loved one. Your loved one may need help with using the bathroom, filling out meal requests, remembering to drink water. They will have difficulty finding the call button or the bathroom. Communicate so that they will understand, and make sure you slow down. See, there is a question. Oh, so you're right, Joanne. I made this presentation before COVID, but bringing a family member or friend isn't always an option, especially right now with COVID. And I think it depends on the hospital, but she's saying that they're even resistant to the power of attorney person coming in with them. And I think it does depend on the hospital, what their rules are. But that can be another added challenge, especially right now with COVID. That can be so frustrating and hard to plan for, because your loved one really does need you there to advocate for them, especially if not just an additional friend or family member, just you. I hadn't even thought to add that to this presentation. So it may be helpful to have an emergency bag already packed so you can grab it and head out the door in the event of an emergency. You want to have all of your important paperwork in there with your health insurance cards, lists of medical conditions and medications you're taking, the doctors you see, your healthcare advance directives, snacks and bottles of water, especially for you. Depends if your loved one wears them. Any comfort objects, maybe their favorite sweater or favorite blanket, change of clothes, toiletries, and medications for yourself, pain medications for yourself. You never know when you're going to have a headache. Paper and pen so you can take notes, and some cash can be helpful too, especially if you're buying snacks or food. All right, so that is the end of the health piece. Does anyone have any questions before we dive into hygiene? I see Joanne is raising her hand. Joanne, would you like to talk? Oh, she typed it in. Scabies is a problem in hospitals too. Yes, there are a lot of other contagious things, not just COVID, that you have to worry about in the hospitals. So making sure you're there to help avoid them and take care of your loved one and advocate for them is very important. All right, so hygiene tips for caregivers. General hygiene. Keep in mind that a person with dementia may forget how to comb their hair, clip their fingernails, or shave. He or she might forget even what the purpose of some items are, such as a comb or nail clippers. They're not doing it on purpose. Continue routines from the past. If the person has always gone to the beauty shop or the barber, continue this activity. If the experience is becoming distressing, it may be possible to have the barber or the hairstylist come to the person's home. Use his or her favorite toiletries. Allow the person to continue to use his or her favorite toothpaste, shaving cream, cologne, or makeup. Model how to complete tasks such as combing your hair and encouraging your loved one to copy your motions. And keep safety in mind. Consider using safer and or simpler grooming items such as cardboard nail files instead of metal ones and electric shavers instead of razors, which can be less threatening. So incontinence is the loss of bladder and or bowel function and control. It's very common in the later stages of dementia. Try to determine the possible causes. If incontinence is a new problem, consult with a doctor to rule out any other potential causes such as UTIs, weak pelvic muscles, or medications. Consider any medical conditions, medication side effects, and obstacles that may be contributing or causing the problem. Some medical conditions that can cause incontinence include UTI, constipation or prostate problems, diabetes, stroke, or muscular disorders such as Parkinson's disease, or physical disabilities that prevent the person from reaching the bathroom in time. Many products can increase urinary frequency, including diuretic drinks like coffee, tea, and soda. Sleeping pills and anxiety-reducing drugs may relax the bladder muscles and can cause incontinence. Other factors that might cause incontinence include not being able to find the bathroom or obstacles in the way of the bathroom, such as furniture or clutter and clothing that's difficult to remove. By determining the possible causes, the caregiver can find strategies to help. Respond supportively to preserve dignity. Reassure the person to reduce feelings of embarrassment. Find ways to preserve dignity. For example, say, anyone can have an accident instead of saying, you wet yourself. Be matter of fact, don't scold or make the person feel guilty. Use adult words rather than baby talk when referring to using the toilet, and respect the person's need for privacy as much as possible. Do not withhold fluids. This can cause dehydration, which can lead to UTIs, increase incontinence, and agitated behavior. You may, however, want to limit fluids before bed or limit those diuretic beverages. Communication is key. Encourage the person to tell you when he or she needs to use the toilet. Watch for nonverbal clues such as tugging at clothing, restlessness, making unusual sounds or faces, pacing, sudden silence, or hiding in corners or behind furniture. These cues may indicate the need to use the bathroom. Learn the person's trigger words or phrases for needing the toilet. The person may use words that have nothing that have to do with the toilet. For example, I can't find the light, but to that person, it means going to the bathroom. Communication challenges often increase in the late stages of dementia. Make it easy to find and use the toilet. Clear the path to the bathroom by moving furniture. Keep the bathroom door open so the toilet is visible. Make the bathroom stand out. For example, place colored rugs on the bathroom floor and lid covers, or post a sign of the toilet on the bathroom door. Make the toilet safe and easy to use. Raise the toilet seat, install grab bars on both sides, and use night lights to illuminate the bedroom and bathroom. Consider a portable commode or urinal in the bedroom in case of nighttime accidents. Remove plants, waste baskets, and other objects that could be mistaken for a toilet. Remove throw rugs that may cause a person to trip and fall. Try setting a regular routine for toilet use. For example, help the person use the bathroom first thing in the morning, every 2 hours during the day, immediately after meals, and just before bedtime. Remind the person to use the bathroom just before his or her usual time. Give the person plenty of time in the bathroom to empty his or her bowels and bladder. You may want to run water in the sink or give a person something to drink to stimulate urination. Afterwards, check the toilet to see if the person has urinated and or moved his bowels. Choose clothing that's easy to remove and to clean. Consider using incontinence products such as waterproof mattress covers, incontinence pads on the person's bed, padded undergarments, or adult briefs. I often hear from caregivers that bathing is one of the most challenging personal care tasks. It's a very personal experience and can be quite awkward for some. People with Alzheimer's and other dementias may perceive it as unpleasant or intrusive, which leads to a lot of difficult behaviors around bathing. A lot of people with dementia become resistant to bathing. The person may no longer remember what bathing is for or doesn't have the patience to endure the lack of modesty, being cold, or other discomforts. Loss of independence and privacy can be very difficult for the person with dementia as well, and the disease may increase sensitivity to water, temperature, and pressure. Do not take disruptive behaviors personally. Remain flexible, patient, and calm. Have calming activities ready for in case the person becomes agitated. For example, play soothing music or sing together. If the person resists bathing, distract him or her and try again later. Establish a bathing routine, keeping in mind the person's preferences. Do they like to take showers or baths? Do they always take showers in the morning or at night? This can help eliminate some of those difficult behaviors. Be prepared and keep safety in mind. Gather all necessary supplies, including towels large enough to completely wrap around the person for privacy and warmth, shampoo and soap ready and within reach before you tell the person that it's time to bathe. Install safety equipment in the bathroom, including grab bars. Place non-skid mats on floors. Use a tub bench or a chair that can be adjusted to different heights. Watch for puddles and slipping hazards. Also, take care to never leave the person with dementia alone in the bathroom. Use products made of non-breakable materials and keep sharp objects such as tweezers and scissors out of reach. The person may not sense if the water is dangerously hot or may resist bathing if the water is too cool. Always check the water temperature, even if the person draws his or her own bath. Lower the thermostat on your hot water heater to prevent scalding injuries. Pad the shower seats and other cold or uncomfortable surfaces with towels. Check that the room temperature is pleasant. Help the person with dementia remain as independent as possible. When bathing a person with dementia, allow the person to do as much as possible. Be ready to assist when needed, but try to only offer the level of help that's necessary. In the early stages, the person may only need a reminder to bathe, but as the disease progresses, he or she will require more assistance. Give the person choices. Do you prefer to bathe now or in 15 minutes? Be sure the person always has a role, even if it's just holding a washcloth or a shampoo bottle. Coach the person through each step. For example, put your feet in the tub, sit down, here's the soap, wash your arm. Now wash your other arm. Use cues to remind the person what to do. Try using the watch me technique and lead by example. Put your hand over the person's hand, gently guiding the washing actions. Make adaptations as needed. You might notice the most difficulty while attempting to wash the person's hair. Try using a washcloth to soap and rinse the person's hair in the sink to reduce the amount of water in the person's face. Or you could sew pockets into the washcloth to help the person hold on to the soap. Be gentle. The person's skin may be very delicate and sensitive. Avoid scrubbing. Check the spray on the shower head to make sure the water pressure isn't too intense. Be sure to cleanse hard to reach areas. Wash in between the folds of the skin and under the breasts. It's important that the genital areas are cleansed, especially if incontinence is a problem. Sponge baths with a washcloth can be effective in between showers. Consider using a non-rinse soap product between showers as well, which can be used with a warm towel and applied under the guise of providing a massage. Protect the person's dignity and privacy. Try to make the person feel less vulnerable by covering the person with a bath towel or blanket while undressing. Let the person hold the towel in front of his or her body in and out of the shower or tub to help ease anxiety. Have a familiar person of the same sex help if that is more comfortable. Cover or remove the mirrors if reflection leads the person to believe that there's a stranger in the room. I do have a video here that I would like to show you. It is with Teepa Snow, and she has a lot of wonderful videos on YouTube. She has some great tips for helping with bathing and making that a little bit easier.
I'm going to get on the, are you right-handed? I need to be on the dominant side of the individual because that's where they have motor memory for doing all kinds of tasks. They don't know how to use their other hand nearly as well. So what I'm going to do is I'm going to get on this side. Now, hold hands like you normally hold hands. Shake hands like you normally shake hands. Go ahead and shake somebody's hand. And realize there's nothing real comfortable about that. I mean, once you shake hands, then it's like, okay, let go. And what we can end up with is a tug of war. Or late in the disease, people with dementia often like a lot of contact, and they'll squeeze you and actually hurt you. And it's like, ow, 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 ow. And where are you going to grab to get them loose? On the wrist. And what you're going to do is bruise them again. Shake hands, but then immediately slide up around so that what you're doing is holding on palm to palm, thumb to thumb, and you've got a lot of palm contact. Try that with your partner. And then turn it so their hand is on top of yours and just relax the hand so that it's very clear it's relaxed. What you're doing is you're putting pressure in the palm, and pressure in a human being's palm calms them down. So what you're actually doing is helping to calm them even while we're doing things, because I'm giving them input into the sensory system. Okay. The other thing that I can do is take the other hand and lay it on top of the hand. And what I'm creating is artificial warmth and padding. What are they missing? Warmth and padding. So all of a sudden we're feeling more comfortable. Now there's a big difference between me being down here where she can see me, because remember the visual field problems? What happens if I'm up here?
I just see the...
Yeah, and what if I face her like this? What she's going to start to do is mess with me here, or she doesn't realize what I'm doing, and it feels to her like I'm bossing her around. So I want to either sit down or get down so I'm at her level and she can really look at me. The other thing I can do by applying just a little bit of pressure, she'll automatically look, and now I can talk to her. I'm going to help you get washed up. Okay? Good. Listen, let's take your shirt off. There you go. Now, that's a little less distressing because she understood what I was doing by being to the side and having a single person in the room. And I'm not being loud, I'm not being noisy. What else do you think we need to think about doing in the room, given that she doesn't have any insulation and I'm about to have her come out of her shirt? Get it really warm. Who's going to need to be sweating? Me. I need to be hot so that when she comes out of her shirt, she's not uncomfortable. Because if she is uncomfortable, is she going to want to take more clothing off? No, because she's cold. Here's the next thing we're going to do. I'm going to take a warm towel fresh out of the dryer and drape it around her shoulders. Now, when I do that, what happens to her exposure in the front? She's covered. She's modest. But what can also happen, she's warmer. Then what I can do is wet her through the towel. I don't even need to take the bra or the under things off yet. Let her keep some modesty, because once you get your clothing wet, what do you think most people want to do? Take it off. And if I haven't had a battle up to now it makes sense to take those off. Okay? Here's the other place I want to put a towel. Across the lap. Why? That's the other modest place, and that's another place that's real sensitive.
So I hope that video helped give a visual and you think about some more tips to make bathing not be so much of a battle. Now, when it comes to getting dressed after the bath, you want to plan plenty of time when dressing or grooming someone with Alzheimer's disease. Rushing the person can cause anxiety and frustration. As the disease progresses beyond the early stages, choosing and putting on clothes can be very frustrating for the person with dementia. The person may not remember how to dress or might be overwhelmed with the choices or the task itself. To limit options, remove extra clothing from the closets, as this can just overwhelm the person with dementia. Give the person just two choices. For example, do you want to wear the red shirt or the blue shirt today? Pick comfortable, simple clothing. Shirts that button in the front, like cardigans and blouses, are usually easier to work than pullover tops. If buttons and zippers are too difficult, you can replace them with Velcro. Choose loose fitting items that are soft and stretchable, as those are more comfortable, and make sure the person has comfortable non-slip shoes. Prepare ahead of time. Lay out the clothing in the order that each item should be put on. Give the person one item at a time while giving simple, direct instructions, such as put your arms in the sleeve rather than get dressed. Be flexible to reduce arguments. It's common for the individual to want to wear the same outfit repeatedly, so instead of arguing, buy duplicates of their favorite items or have similar options available. Even if the person's outfit is mismatched, try to focus on the fact that he or she was able to get dressed. We really want to focus on safety. So if they're mismatched, it's not really hurting anyone as long as they're wearing clothing that's comfortable and appropriate for the weather. That's what's really most important. So it's really important to choose your battles carefully. And the most important thing is to maintain good personal hygiene, including wearing clean undergarments, as poor hygiene can lead to UTIs or other infections that could further complicate care. It's all right if the person wants to wear several layers of clothing. Just make sure he or she doesn't overheat, especially in the summertime. When outdoors, make sure the person is appropriately dressed for the weather. Oral care. In the later stages, the person with dementia may forget how to brush his teeth or forget why it's important. So as a caregiver, you may have to assist because proper oral care is necessary to prevent eating difficulties, digestive problems, and infections. Find a dentist with experience working with dementia or elderly patients. You can contact your local dental society to find the names of these professionals. Give the dentist a list of healthcare providers who are caring for the person with dementia, as well as a list of medications. Certain medications can contribute to dry mouth or other oral health issues. Keep up with regular dental visits, for as long as possible to prevent tooth decay, gum problems, pain, and infections. Daily oral care. In the early stages, dental care focuses on prevention. The person you're caring for may simply just need reminders to brush their teeth twice a day, floss, and get regular checkups. This prevents the need for extensive procedures later on. During the middle and late stages of Alzheimer's, the person may forget what to do with the toothpaste or how to rinse, might be resistant to assistance from others. Look out for indicators of mouth pain or ill-fitting dentures, including loss of appetite, as the person with Alzheimer's may no longer be able to communicate that with you. Give clear instructions. Explain dental care by breaking directions into simple steps. Instead of saying, brush your teeth by itself, which might be too vague, walk the person through the process. Say, hold your toothbrush. Now we're going to put a small amount of toothpaste on the brush. Then brush your teeth. Or watch me and brush your teeth while the person with dementia is brushing theirs. Hold the toothbrush and show the person how to brush his or her teeth, or put your hand over the person's hand, gently guiding the brush. Brush the entire mouth at least twice a day, with the last brushing after the evening meal and any nighttime liquid medication. Allow plenty of time and find a comfortable position if you must do the brushing yourself. Gently place the toothbrush in the person's mouth at a 45-degree angle so you can massage gum tissue as you clean the teeth. If the person wears dentures, rinse them with plain water after meals and brush them daily to remove food particles. Each night, remove them and soak them in cleanser or mouthwash. Then use a soft toothbrush or moistened gauze pad to clean the gums, tongue, and other soft mouth tissues. Floss regularly. Most dentists recommend flossing daily. If using floss is distressing for the person with Alzheimer's, use a Proxa brush to clean between teeth instead. Experiment with different types of toothbrushes. For some, soft bristled children's toothbrushes work best and better than hard bristled adult brushes, or one with a long handle or an angled brush might be easier to use than a standard toothbrush. Experiment until you find the best choice. Electric dental appliances may confuse the person with Alzheimer's, though, so an electric toothbrush may not be the best option. That brings me to the end of my presentation. If you have any questions, feel free to type them into the chat box now. I know I have one or two that I still have to answer. And I do want to let you know before I get into those questions that every time I do one of these webinars, I have a book that goes along with it. So the book that goes along with this presentation is Surviving Alzheimer's: Practical Tips and Soul-Saving Wisdom for Caregivers. And it has several sections that I felt really relate to this presentation. That's why I chose it. So it has sections on hygiene and on health, as well as many other topics that I think are very relevant for caregivers. So if you would like a copy of that book and you live in the Clinton County area, I am happy to drop that off to you. If you live further away, I'm happy to mail that to you. Just let me know. And you could either type it into the chat box or get in touch with me after the presentation, and I can get you a copy of the notes. I have some other resources that I like to give out, and again, this book. And someone's asking in the Q&A, I've had trouble at the hospital because my mother sounds coherent, but can't answer questions accurately on her own. They dismiss the need to include me in the conversations due to this. They think her answers are accurate when they are not. How do you get around this? I think the best way to get around it, and really one of the only ways I can think of, is to try to talk to the doctor privately when your mom's not around and say, I know she sounds really coherent, but she's not telling you the full story, or you know, she's misremembering this because of her dementia, and she's very, very good. I think that's very common with dementia. A lot of times people are very good at keeping it together, of sounding like they don't have any memory issues. You know, they go into their polite, I know what I'm talking about kind of attitude, and they can trick a lot of doctors or other people that you come into contact with in public. So I would recommend pulling the doctor to the side, or a nurse or someone else at the hospital, and just saying, you know, I'd really like to talk to the doctor privately. My mom's not giving the full side of the story. I hope that helps. Are there any other questions? I do want to let you know about a couple of other upcoming events. So if you have questions while I talk about these events, still feel free to type them in. I'm doing coffee chats about senior health every Wednesday morning at 10 a.m. And we have different guest speakers. And this week's guest speaker is from the CIAD, which is the Center for Excellence in Alzheimer's Disease. So I'm very excited to be partnering with them. I think they're a wonderful organization, very relevant to our caregivers. So if that is something that you are interested in and in hearing from someone from the Center for Excellence, it's at the Glens Falls Hospital, please let me know. I'm happy to send you the link to register for that as well. Again, it's Wednesday mornings at 10 a.m. I'm also continuing with support groups, memory cafes, and this webinar series. So we have another webinar that's happening next Monday at 1 p.m. Yeah, someone just asked if they could get a book. Yes, you can certainly get one. I'll drop one off to you. And then the other thing I wanted to let you know about is in April, I'm going to be offering a different type of virtual training. This is a 6-week training, meets for 2 hours a day for 6 weeks, or 1 day a week for 6 weeks. It's also on Mondays, Monday afternoons from 1 to 3. And it is the Powerful Tools for Caregivers workshop. I'm a trained person in this training, and it gives a lot of really hands-on, really valuable techniques that you can easy to implement in your daily life. It's not something that's going to be really hard and abstract. It's a good way to meet with other caregivers. It's a very hands-on training, so you'll be able to talk to other people who are also caregiving and get ideas and strategies from them. So in some ways, it's kind of like a support group. It's a really wonderful program. So if that's something you're interested in, again, it's free, it's open to the public. I'm partnering with Jody Smith from the Washington County OFA to offer that. So yeah, if that's something you're interested in, please let me know and I will get you signed up for that. Otherwise, if there are no other questions, I hope to see you at one of my upcoming events. If you think of anything that you're wondering about after we get off the presentation, feel free to give me a call.